Hello, I'm Dr. Jule Miller. I'm a child psychiatrist as well as a general psychiatrist, and I've been treating ADHD for over 30 years. I treat it in children, I treat it in adults, and I'm here to talk about the kind of treatments that might be helpful for you or for your child if either of you are diagnosed with ADHD. This is not a video about how to diagnose ADHD. That can be a separate video, it would take quite some time. But I'm going to give you an overview of the current treatments and recommendations and what I've found to be helpful over the years. Chances are, if you go to a nurse practitioner or a psychiatrist or a general practitioner, you're not going to get as much time as you need to discuss all these options. You'll get a specific recommendation and that'll be it. You can look on Google, you can check on Reddit and all kinds of other sites to find out what other people have found to be helpful. But I want to give you my expertise of having done this and treated hundreds and hundreds of patients over the years as far as what I've felt has been helpful. So the first thing you need to know is before we even start treating ADHD, we need to learn ways to make whatever treatment you're going to use more effective, to prepare the way, so to speak. So the first thing I tell my patients is you've got to get regular, good sleep. If you have regular, good sleep, chances are your symptoms will be at a minimum, and if you use medication, the medication is going to be more likely to be helpful. And if you use behavioral methods, those methods are more likely to be helpful than if you are tired. The second thing is to try to minimize stress. Any disorder we have, whether it's ulcers in our stomach or heart palpitations or ADHD, is going to tend to worsen under stress. So a lot of times, when I evaluate somebody for ADHD, I have to try to sort out, well, how much is this inattentiveness or hyperactivity really due to ADHD, and how much is due to the stresses the person is under, and what do we need to treat first? So you try to minimize your stress, you try to have a regular schedule, and especially important to have a regular sleep schedule. You need enough sleep. So for adults, you're talking like 8 hours, and for kids up through teenage years, you're talking like 10 hours. Now, I don't know any teenagers that get 10 hours, but that's the general recommended amount. In any case, the closer you get to that, and the more you go to sleep about the same time every night and get up every morning about the same time, the more your body's natural biorhythms all get in sync. And the better you're getting able to focus and concentrate and keep control of your behavior and impulsive tendencies than you would be otherwise. So start with that. You got to get that as a base to go from. A healthy diet's a good idea. A regular exercise can help ADHD symptoms. Yoga, meditation. There's a number of things that can help. If we're talking about a school situation, sitting up towards the front of the class, being a little bit away from some of the other kids, or at least the other kids that tend to be more hyper, those can all help. Taking careful notes. If you're an adult, blocking out your time, and actually for kids too, having specific amount of time to focus and then frequent breaks and then returning to focusing can help. For adults, there's a method called the Pomodoro method, which you can look up on Wikipedia and look up online, which basically involves setting a timer. Originally, it was called Pomodoro because the man that came up with the idea was using a tomato-shaped timer and a kitchen timer, and set it for however amount of time you think you can focus. Let's say it's 15 minutes on a project. You set it and you really push yourself those 15 minutes to do it, knowing that when it dings, when it goes off, or if you're using an electronic timer, whatever sound it makes, that you'll have a break. And then take that break. But a short break, and then go back and set the timer again. So you break your work up into chunks. You try to focus on each chunk the best you can. Then you have frequent breaks. So you don't get bogged down with feeling like you're going to have to sit there for hours. And just the idea of that can aggravate people's difficulty focusing. So make sure to take frequent breaks. And that goes for kids as well in classrooms if that can be arranged. So that's one method to look into. Now let's talk about, and of course, regular sleep, exercise, all that's helpful, a decent diet. Now, are there supplements that can help? There are some supplements that can help. One in particular that I found helpful is citicoline, which is available through Amazon and other places. That increases the amount of choline which then becomes a neurotransmitter, acetylcholine, in the brain, and that can be helpful. But it doesn't necessarily last for a long period of time. For a few weeks, it can help make the medications work better, that's for sure, and it can help on its own. There are some other supplements that may be useful as well. But I'm going to jump ahead and talk about the medications, because in most cases of moderate to severe ADHD, we're going to be talking about medicine of some sort or another. You know, if you've got ADHD, in one sense, it's an illness in this modern society. But in the other sense, it's been something that's probably been carried with us through evolution, because it does have advantages in certain situations, at least in the more moderate forms. I don't know if we would have spread out of Africa, which is where humanity originated, in southern Africa, if we didn't have those people who just got bored of staying in the same place and decided to see what was over the next hill and kept moving. There was a book once called Hunters and Farmers I believe by a psychologist, which emphasized that people with ADHD might more naturally make good hunters because they're constantly shifting their attention around through the environment and are more likely to see the tiger coming at them than average people. Whereas people who don't have ADHD are more likely to make good farmers because they can sit there and watch the crops grow. So our modern school systems and many of our jobs are much more like the farmer kind of situation, where you have to sit still and quietly and all that. And that's very hard for anyone with ADHD to do. And with severe ADHD, it's virtually impossible without some kind of medication. ADHD, I think people with ADHD are probably overrepresented among artists, among creative types in general, among entrepreneurs. I think it really does have some advantages. But for when you're going to school, or if you have a more regular job and you're not out there being an entrepreneur, it can get in the way. So let's look at some of the options. There are basically two or three, or four, actually about four main medication options. The first one is the stimulants, or are the stimulants. And those primarily divide into methylphenidate and the amphetamines. Both of them work immediately. The first day you know if it's going to help or not. So that's a big advantage, especially, let's say, if someone is failing in school, that is coming right down to the wire, or if you're about to be fired from work. That's the quickest thing that can help. However, stimulants, although they're very effective, have a number of side effects and limitations that are partly political and legal, which has to do with the fact that people have abused stimulants in the past, and still abuse them, particularly methamphetamine, which is actually still sold as a medication for ADHD, but is rarely used nowadays. Instead, dexedrine, or dextroamphetamine, is the one that tends to be used, but they're basically the same type of medication. And because of the potential for abuse, the government has really restricted companies and how much they can make. They've restricted doctors and come after people if they felt like they've prescribed too much. So particularly the quotas that the government has set has made it a stimulant shortage that's been going on since COVID and hasn't let up. So if you're dependent on a stimulant, you can be out of luck one month and doing fine the next, and then out of luck the one after that. So that's problematic. However, that being said, they've been used for more than 50 years. They're extremely effective. If used as prescribed, they are very safe. They do have some side effects, even when used as prescribed, which sometimes can make people not use them at all. There's really only two classes of the stimulants: the methylphenidates, and Focalin is just half of what's normally in the other methylphenidates, and the amphetamines, which include Adderall, Vyvanse, dexedrine, and Zenzetti, numerous others, but they're all basically the same molecules. Basically two sets of molecules, that's it. And they're available in different kinds of release forms, which might be helpful under certain circumstances. For instance, Jornay is a methylphenidate preparation, one of the versions that you can take at night, and then it's a delayed release. So then it releases right when you're waking up in the morning, so you don't have to wait for it to kick in. And that can be useful. Vyvanse, which has just recently gone generic, if you can find it, has been one of my favorites because it's a prodrug. It goes into your red blood cells and is converted into the active dexedrine, but it is converted in a very smooth way during the course of the day. So that often avoids the ups and downs, which can come from some of the XR or extended release versions of these medications, such as Adderall XR, which will release a fair amount of stimulant, an initial burst early, and then there's a drop before the second burst after that. And you can feel like you're on a roller coaster during the day for some people. So another disadvantage of stimulants, besides sometimes the lack of availability, is that they can cause a number of side effects in a fair proportion of people. For instance, in kids, I often see problems with appetite. So kids at school on these stimulants often have problems with eating lunch. They just simply won't have lunch. Now, this isn't an overwhelming problem because in the evening, as the medication comes out of them, they can usually make up the calories. However, some kids really need to take some evening medication to do their homework. And then they're kind of stuck, so that they end up waking up in the middle of the night and wanting to eat stuff. And that's not good because it destroys that sleep-wake cycle that I was talking about earlier, which is crucial not only for allowing your medications to work, but also for general physical and mental health. So that can be problematic. Although in most cases, in my experience, that's not a deal breaker. There's ways around that. In some cases it is, and we'll talk about other medicines that can be used in those cases. Another problem is sometimes they last too long and the child has problems falling asleep. This can happen to adults too. In those cases, most providers will prescribe clonidine, which is also used for ADHD, but it's very good for helping people get to sleep after they've been on a stimulant all day. So again, it's usually not a deal breaker, but it is a significant side effect that happens to a minority, but significant minority of people who take stimulants. Another one is irritability and anger, and this is more problematic. And it can happen in two different instances. It can happen when the stimulant's in you, and it overdrives you and increases a person's irritability and anger, and that is more problematic, and that means basically that stimulant at least is not appropriate for that person, at least at that dose. Or it can happen during the withdrawal period. So you see, what goes up must come down. So the stimulant brings the kid's ability to function and focus and motivation up while it's going, but when it comes down, there's a drop below baseline. And during that time, the children could be more hyperactive, adults can have worse problems paying attention and functioning cognitively than they normally would if they had never taken any stimulants. So that usually lasts for about an hour or two. And it can be the hell hour for some of the hyperactive kids that are coming off of it. And for adults, it can be really a time where they can't function mentally very well at all. And I usually say, well, look, just, if it's a young child, let them outside to play or let them stay in the room and rummage around and make a bunch of ruckus in there, if that's possible. And if you're an adult, then just relax, have some dinner, don't try to do anything cognitively demanding until that's all come out of you. But in any case, that is a more significant problem, I think, that what goes up must come down. And you have to be aware of that. And there's different ways of handling that. Sometimes a combination of medicines will work. And that gets us into our next category of medicines, which I'm going to talk about, which are the blood pressure medicines, which are really technically alpha-2 agonists. That means the alpha refers to a type of norepinephrine receptor. Norepinephrine is one of the neurotransmitters in the brain and one of the ones that's most important for focus and concentration. An alpha-2 agonist means it's stimulating alpha-2 receptors in the brain, but both of the two medications that have been approved for ADHD also stimulate alpha-1 to a degree, a different degree, depending on which one you're using. In any case, the two medications are guanfacine, which comes in either short-acting form, name brand Tenex, or long-acting form, name brand Intuniv. It's the Intuniv that's approved for ADHD in kids, but I frequently use the short-acting one, especially in the beginning when I'm trying to figure out what might work. It's easier to have the parents adjust it and play with it a little bit to find out what's the right dose. And then I can extrapolate from there to figure out what might work for a longer-acting guanfacine. But you can't go dose for dose exactly because the longer acting is spread out basically over 24 hours. So you have to figure you're going to need a little bit more of that. In any case, that's one. The other is clonidine, which comes in both a short-acting form and immediate release. Catapress was the name brand. You can't really find it under name brand anymore. Or a long-acting version, Capve, and it's the long-acting version, again, that's been approved for ADHD. However, I've never used that long-acting version. The reason is because clonidine is much more sedating than guanfacine. They both help with focus, concentration, and particularly hyperactivity and impulsivity. So if I have a really hyper kid, I'll probably start them on, especially if they're young, I'll probably start them on immediate release Tenex or guanfacine to try to get the hyperactivity more under control before I might add a little bit of a stimulant if they need extra focusing help. Or I'll add one of the other medicines that I'm going to get to after we talk about these. Clonidine I tend to mainly use at night for sleep. So I might give them an Intuna, which is a long-acting guanfacine in the morning to help them focus through the day. And then at night some clonidine, which will also help their ADHD overall, but mainly to use for sleep at night. Sometimes with some extremely hyperactive kids, I'll give them some clonidine during the day as well. Again, I haven't used the Capve. That may be very good. It's just not something I've played with because in general, I try to stick to guanfacine if I'm talking about the primary symptoms, and then only use the clonidine primarily for sleep. But I do have a few children who I've had on higher doses. They are also useful in adults. But in adults, because our metabolisms are slower, we can often get away with just a immediate release guanfacine once a day, rather than the twice a day you'd have to use in kids. And you won't necessarily have to use the extended release, but you can use the extended release. And clonidine is also helpful for adults, particularly for sleep. But both these medications do treat the primary symptoms of ADHD, particularly the hyperness and the impulsivity, more so than the focusing, although they have some benefit for that as well. So nowadays, if you ask what is the most typical way of prescribing or most recommended way of prescribing for ADHD, you'll find that most people will tell you that stimulants are the first choice. I tend to go, especially with young children, with guanfacine as my first choice and add stimulants later if needed. But everybody's different. Anyway, I found that to be very helpful. And guanfacine and clonidine, you don't need to worry about shortages in general. And you can put lots of refills on them. You can't put any refills on the stimulants. If you go to your doctor and you need Adderall every month and you're not going to see your doctor for 3 months, you're going to have to get 3 separate prescriptions, and your doctor's going to have to write 3 separate prescriptions, and they're going to have to check the physician's prescribing monitor system in their computer to make sure that you're not getting your medications from anyone else, and it's a big hassle. So that's a problem with stimulants in general. But they're very effective. So let me move on to another class of medications, which could fall into the general heading of antidepressants, but they're basically norepinephrine reuptake inhibitors. And that includes Strattera, or atomoxetine is a generic, it's now generic, or Quellbri, which is a more recent name brand norepinephrine reuptake inhibitor, and some older ones such as dizipramine, which is a tricyclic antidepressant, which is primarily a norepinephrine reuptake inhibitor, imipramine, and Pamelor. Those are all old tricyclics. They've all been shown to be effective in ADHD. Imipramine used to be my favorite drug for ADHD. You could give it at night, put plenty of refills on it, and for most kids it is very good. I don't use the tricyclics as much now because you need to check an EKG to make sure it's not, that there's not any problem with the electrical system of the person's heart, because if there was, that could worsen it. And so I tend not to use those as much right now, but they're quite effective and they're very inexpensive. And I would use them in cases where, for instance, Strattera might not work, or a stimulant might not work, or I wanted something for both bedwetting, anxiety, and ADHD, and sleep, in which case imipramine covers all those things and does a very good job of it. So let me talk a little bit about Strattera, because that's the main one I prescribe out of that class nowadays. Quellbri is really expensive because it's a new medication. I'm sure it works just great, but Strattera is the same kind of medicine, it's generic, and it's pretty inexpensive now. So Strattera is something that takes a couple weeks to start working. That's the main thing to know. It works just as well as the stimulants in about 50% of people. So really, in half the people, it's very effective. You can put lots of refills on it. There's no PMP to check for the physician. You can use the stimulants with Strattera, which is atomoxetine. If the Strattera is not quite enough, you can add a little bit of stimulant or a little bit of stimulant, let's say at night for homework, but you avoid having to use regular stimulants. Another side effect of stimulants I didn't talk about for children is that if you stay on stimulants the whole time you're growing with no breaks, you're going to lose about 1 inch of height. Whereas it's not clear with Strattera if that would happen or not. But it is clear with the stimulants. So, and there's other issues that can come up as well. But in any case, Strattera is a very good medication. It's underutilized by most pediatricians and even child psychiatrists, nurse practitioners, because it takes a little while to start working. And sometimes people only come in where they're in the middle of a crisis and they need something right now. Nevertheless, I highly recommend it as a medication that can help, particularly with focusing. And a good combination is often guanfacine and Strattera. That combination helps with the hyperness, it helps with the focusing, it helps with anxiety to some degree with the guanfacine. So that's a whole other class of medications, which are the general norepinephrine reuptake inhibitors, or some of the other antidepressants. Wellbutrin, which is an antidepressant that increases dopamine in particular, has also been helpful for ADHD, and I will use that in some people who also have depression. However, I think it's less helpful than the norepinephrine reuptake inhibitors in my experience. Okay, so we've talked about the stimulants, we've talked about some of the blood pressure medicines, we've talked about some of the antidepressants. What else is there? Well, some people have tried CBD with their kids and have reported to me that it's helpful. I haven't prescribed that or anything, but some people have found it helpful. I don't know what the long-term effects would be. Remember, the stimulants we've been using for over 50 years, so you have something, you know what the risks are, you know what the safety and side effect profile is. We really don't know what CBD might do to the growing brain, but that's something that some parents have tried. Amantadine is a medication that's sometimes used for Parkinson's and has been used for influenza in the past. And I've had a couple of kids respond quite well to that. And again, that's not a controlled substance. So there are other options out there. There's other medications that have been tried. Provigil's been tried. But I think the main medications that are the most helpful that I've come across so far, and I haven't had enough experience with amantadine, I may try that with some more people and have a follow-up video at some point. But the main medicines that help, and they're used the most, tend to be the stimulants, the blood pressure medications, and the antidepressant-related medications, such as, again, the stimulants, we're talking about Adderall and Ritalin and all the variants. The blood pressure medicine, we're talking about guanfacine and clonidine, and that's basically it. The other medicines that affect blood pressure don't seem to be as helpful for ADHD as far as I am aware of, but clonidine and guanfacine really are. And then medicines that generally fall in the antidepressant class, the norepinephrine reuptake inhibitors, and in particular Strattera, which I found very, very helpful. Now, everybody's unique, so you may or may not respond to one of these medicines. You may or may not have side effects to one of these medicines. In general, when I'm prescribing medications, I believe in start low and go slow. If you're going to use Strattera, you have to remember, you're going to take Strattera, it's going to take a couple of weeks. And the first couple of weeks of, and that's probably true to a degree also with guanfacine, in those first couple of weeks, people can have some side effects, some adjustment of their body to that medication. So for guanfacine, typically people feel tired those first couple of weeks. Usually after a couple of weeks, their body adapts to that and they're not tired, and it works. Sometimes you have to increase the dose after those first 2 weeks with guanfacine. And I found that giving it to kids, in those kids I've had to increase the dose, it's usually just once that year. And then it's good, until they grow and they're bigger. And most kids, in my experience, overcome that tiredness and do fine. There are a few kids, though, that becomes a deal breaker, and we have to stop it and try something else. Now, one thing to be aware of is if you get the immediate release guanfacine, you can cut it into pieces with a pill cutter. And that allows you to experiment some, because some kids, instead of a half a pill, they need a quarter pill because they get too tired on a half a pill. And they can gradually build up from there to what works for them. Strattera as well takes about 2 weeks to start working, whereas Adderall works right away. So if people have had Adderall in the past, they may be frustrated, feeling, well, why isn't this working? Well, it's not going to do anything for a couple weeks, that's why. But at the end of those 2 weeks, if you look back to the beginning, you'll probably realize your concentration is getting better. And then another week later, you look back, you probably realize it's getting better still. And if it's getting better somewhat, but not enough, there's a broad dosage range that can help. And if you reach the maximum on your dose of that, you're not having any side effects, it's helped you a lot, but not quite enough, you can add a little bit of a stimulant. And because you can give a little bit, you're less likely to run out of it, especially if your prescriber gives you a kind of a full course stimulant dose that you can cut down if it's an immediate release stimulant by using, again, a pill cutter. So there's lots of options, and that'll give you at least some baseline to go from. Some parents and patients have been scared that, oh, I'm giving a blood pressure medicine to their kid, that somehow that would be more risky than, let's say, a stimulant. But I haven't seen any problems, again, in hundreds and hundreds of kids, as far as any kind of serious side effects from these medications. I've seen some side effects like tiredness that may be a deal breaker in some kids, but otherwise, no. And the same thing with the stimulants. They can have a little bit more severe side effects if it triggers like an angry, aggressive, rageful episode. And this might have to do with some kids that are going to develop bipolar disorder or that have some kind of underlying other problem with anger that can be amped up with the medication. And in those kids, probably it's best to start with something like guanfacine or possibly Strattera. I've seen much less aggression and anger with Strattera than I have with the stimulants. It's much less likely. So a lot of times just switching to that will do it and help people. So I hope this has been helpful for you, just considering the different options. But remember, no matter what medication you use, if you get a good night's sleep, it's going to work better. And if you don't get sleep, it's not. And if you're under stress, you're going to not be able to focus as well. So when you go to your doctor saying, I don't think my medicine's working anymore, one thing to consider yourself, if your doctor doesn't ask you, is, are you under more stress right now? So it may be your medicine's working as well as it can work, but it's simply overridden by the stress you're under. And then you should probably look at, how can you reduce your stress? What can you do? In some situations you can't, you just have to get through it. And in those cases, let's say you're on Adderall, then adding a little bit of guanfacine may help you, because that's more likely, again, because it's a blood pressure pill, just to calm everything down, as well as improving focus, rather than increasing the Adderall, which can cause more difficulties. Something to know, stimulant medications tend to work in an inverted U-shaped curve. So, a little bit helps some, a little bit more helps more, but then you reach a plateau. And if you increase the dose further beyond that, your functioning decreases, it doesn't increase. So you become overdriven, and you might start having headaches. It's another common side effect with stimulants, especially if it's too high a dose, or if people are just starting out, or if they are having a withdrawal headache, that you can get that too. But primarily the headaches are when people just start out on a stimulant, and if they go off it on the weekend and go back on Monday, they might have a headache Monday, which might be a reason to take it over the weekend if that's too bad. But it can also mean that the dose is too high. You don't want the stimulant dose to be too high. It'll interfere with your processing of information in your brain. It won't help it out. Anyway, that's my talk today about ADHD, and I hope you all have a good week. See you next time.